Rotavirus affects millions of children each year and can be very life-threatening if untreated. The Centers for Disease Control and Prevention states that rotavirus is a contagious virus that can cause gastroenteritis. Rotavirus is the most common viral cause of rotavirus gastroenteritis. The history of vaccine states rotavirus is a double-stranded RNA virus of the retrovirus family. Under an electron microscope, the virus is shaped like a wheel, hence the name rota. Before the vaccine was developed, around 400,000 doctor visits and 200,000 ER visits occurred annually in children, with as many deaths as 60 deaths annually. The CDC states that it was the first identified cause of diarrhea in 1973. Many children are affected each year by this virus. Rotavirus causes 29% of deaths due to diarrhea among children under 5 years of age. WHO estimates that 2.5 million episodes of diarrhea occur annually in children under 5 in developing countries. This virus occurs mainly in children aged 2 because of the high susceptibility to contact with infected surfaces and placement of their hands in their mouth. Rotavirus can also be spread from a history of respiratory infection that causes secretions as well as person-to-person contact. It can be spread among infants and young children both before and after they become ill with diarrhea. Many children that attend daycares, preschools, long-term care facilities, and children who are immunocompromised tend to be identified. When infected with rotavirus, it is not a pleasant experience for children to go through. Some signs and symptoms include watery diarrhea, often including vomiting. A low-grade fever occurs with severe abdominal pain. Symptoms can last anywhere from 3 to 7 days. A history of respiratory illness is a large factor in the development of rotavirus because it can cause the body to become immunocompromised. Hyperactive bowel sounds with bloody diarrhea often occur. Blood in the stool after maximum fluid loss has occurred and useful in determining the stage of the illness. Tenesmus is infective, painful, and continuing urge to defecate, which can be a common symptom with children. It is important for a nurse to educate the parents of a child about vaccination against the virus. Vaccination of the rotavirus should be administered at ages 2, 4, and 6 months, with a series being completed by 32 weeks. The vaccination should not concern the parents with the dangers of injections because the vaccine is given orally. Hand washing is the key to preventing the spread of rotavirus. The nurse should evaluate the food and formula preparation at home for cleanliness and sanitation. Parents should be instructed to disinfect contaminated linens, clothes, and diapers. Surfaces and disinfectant sprays are important because children are often climbing on tables and eating food off contaminated surfaces. To detect if a child is infected with rotavirus, the stool should be examined with enzymes. Unfortunately, the cultures are very expensive and can often result in false negative findings. The presence of white blood cells in blood and stool can support the diagnosis. A sigmoidoscopy can determine mucosal involvement to obtain more reliable culture samples.
Are you done here? Excellent.
That's the water, just so you.
Oh, hey, Kim, how you doing?
Supportive care, restoring hydration, and electrolyte balance are crucial for treatment. Contact precautions should be used for at least 2 weeks to ensure the virus is not spread. Contact precautions include gowns and gloves being worn when in contact with the patient. A nurse is able to treat symptoms of the virus to aid in quick resolution. Pain and fever can be treated with acetaminophen. Anti-diarrhea should not be given because they could irritate the bowel and prolong the disease. Patients should be instructed to eat foods and of complex carbs, starches, lean meats, and veggies. High fat and sugar should be avoided. Oral parenteral rehydration can correct acid-base imbalances. Nurses should implement input and output, daily weights, and contact precautions. Some nursing diagnoses include fluid volume deficit, imbalanced nutrition, less than body requirements, and diarrhea. Parents should be informed of prevention and home care when their children are at risk.